Hello friends, welcome to our channel Tricks World. Today we are going to discuss some multiple choice questions from the topic Central Nervous System on pharmacology. Before that, if you are not subscribed to my channel, subscribe it so that we can grow together. Let's start with our first question.
Strict oral hygiene is instructed to those on option A phenetoin, option B carbamazepine, option C sodium valproate, and option D metformin. Answer is option A phenetoin. Phenetoin have a side effect that is gingival hyperplasia. When a patient is receiving phenetoin, strict oral hygiene should be maintained. Which of the following group of drugs to be withheld if he or she shows classical signs of Parkinson's disease? Options: A. Mood stabilizers, B. MAO inhibitors, C. Antipsychotics, D. Anti-epileptics. Answer is option C. Antipsychotics. Because antipsychotics generally reduce dopamine level. So when the patient is showing a classical sign of Parkinson's disease, we should withhold these antipsychotics. Which of the following drug to be withheld before a contrast based procedure? Options: A. Paracetamol, B. Aspirin, C. Metformin, D. Eptoin. Answer is option C. Metformin. Because metformin, when we are giving with the contrast media, it may leads to liver toxicity. So the metformin should be withheld before a contrast based procedure. Which of the following is the first drug of choice for status epilepticus? Option A phenetoin, B phenobarbital, C lorazepam, and D carbamazepine. Answer is option C lorazepam. Which of the following medication has to be avoided for a patient taking anti-Parkinson's disease? Options: A. Bromocriptine, B. Anticholinergics, C. MAO inhibitors, D. COMT inhibitors. Answer is option C. MAO inhibitors. MAO inhibitor is monoamine oxidase inhibitor. When patient taking anti-Parkinson drug, MAO inhibitor should be avoided because when we are giving MAO inhibitors with anti-Parkinson medication, it may leads to hypertensive crisis. Which of the following drug kept ready during tensilone test? Options: A. Atropine, B. Physostigmine, C. Dopamine, and D. Hydrocortisone. Answer is option A. Atropine. Because sometimes tensilone test cause bradycardia as a result of increased adrenocorticotropic hormone level. So atropine should be kept ready. I hope you know that the tensilone test is used for diagnosing myasthenia gravis. Which of the following investigation to be done routinely for a patient using carbamazepine? Options: A. CBC, B. RFT, C. TFT, D. Serum electrolyte. Answer is option A. CBC. A complete blood count should be investigated routinely for a patient using carbamazepine because carbamazepine causes blood dyscrasias, so the count should be monitored regularly. Which of the following vitamins should be restricted for a patient on levodopa? Options: A. Vitamin A, B. Vitamin B1, C. Vitamin B6, and option D. Vitamin B9. Answer is option C. Vitamin B6. Vitamin B6 is pyridoxine. Pyridoxine and high protein diet reduce the effectiveness of dopamine. When a patient is taking anti-Parkinson drug, that is levodopa, vitamin B6 and high protein diet should be restricted. It decrease the absorption and metabolism of dopamine. Which of the following is a drug of choice for Parkinson's disease? Options: A. Amantadine, B. Bromocriptine, C. Levodopa, D. All of the above. Answer is option D. All of the above. Because amantadine, bromocriptine, and levodopa are the drug of choice for Parkinson's disease. What is the therapeutic range of phenetoin? Options: A. 1 to 2 microgram per ml. Option B. 5 to 10 microgram per ml. Option C. 10 to 20 microgram per ml. And option D. 20 to 30 microgram per ml. Answer is option C, 10 to 20 microgram per ml. 10 to 20 microgram per ml is the therapeutic range of phenytoin. Slurring of speech indicate increased level of phenetoins. L-dopa is especially effective in relieving which clinical motor feature of parkinsonism? Options: A. Tremor, B. Bradykinesia, C. Equally effective in managing both features, and option D. None of this. Answer is option B. Bradykinesia. L-dopa is very effective in relieving this clinical feature, that is bradykinesia, the motor feature of parkinsonism. Which of the following antipsychotic is responsible for cardiac arrhythmia? Options: A. Chlorpromazine, B. Clozapine, C. Thioridazine, D. Haloperidol. Answer is option C. Thioridazine. Overdosage of thioridazine can cause cardiac arrhythmia. Frequent ECG and vital signs monitoring of the overdosage patient is recommended. Observation for side effect recommended for several days because there is risk for delayed side effect also. Plasma lithium level may become toxic in the presence of all of the following except option A, pregnancy, option B, use of thiazides, option C, dehydration, and option D, use of some non-steroidal anti-inflammatory drugs. Answer is option A, pregnancy. During pregnancy, plasma lithium level may not become that much toxic. Clinical studies have shown lithium blood level to decrease significantly during pregnancy. An average decrease of 24% in the first trimester, 36% in the second trimester, and 21% in the third trimester was described. Which of the following drug is contraindicated in a patient with porphyria? Options: A. Zolpidem, B. Chloral hydrate, C. Buspirone, D. Phenobarbital. Barbiturates like phenobarbitons are contraindicated in patients with acute intermittent porphyria because they may precipitate an attack. It is manifested by severe abdominal pain, nausea, vomiting, and psychiatric and other neurological disorders. Flumazenil. Options: A. Is cleared renally. Option B. Predictably reverse benzodiazepine induced respiratory depression. Option C. Antagonizes central nervous system effects of opioids. And option D. Has a half-life of around 10 hours. Answer is option D. It has a half-life of around 10 hours. The opiate associated with seizure when given in high dose to a patient with renal failure is option A, morphine, option B, pethidine, option C, methadone, option D, fentanyl. Answer is option B,
Pethidine. Pethidine is associated with the seizure when it given high dose in renal failure patient.
Patient complains of postoperative muscle pain. This is most likely due to option A, succinylcholine, option B, propofol, option C, isoflurane, option D, atracurium. Answer is option A, succinylcholine. Succinylcholine is the brand name of succinylcholine. An incidence of muscle pain as high as 90% have been reported after the use of succinylcholine. Which of the following is true about lithium? Option A, it has a rapid onset of action. Option B, is partially renally excreted. Option C, has no neurological side effect. Options D, is contraindicated in sick sinus syndrome. Answer is option D. It is contraindicated in sick sinus syndrome. Lithium is a contraindication of sick sinus syndrome. Is a group of heart rhythm problem due to problems with the sinoatrial node or SA node or sinus node. This group of syndrome include sinus bradycardia, sinus pause or sinus arrest, episode of a fast heart rate, and tachybrady syndrome. Which of the following statement is true regarding adverse effect of propofol? Option A, post vomiting is common. Option B, hypertension is a complication. Option C, severe acidosis can occur with its use in pediatric respiratory infections. And option D, it is positively inotropic. Answer is option C, severe acidosis can occur with its use in pediatric respiratory infections. Which of the following side effect for given drug is wrong? Option A, Phenetoin-gum hypertrophy. Option B, ethosuximide hirsutism. Option C, phenobarbital enzyme induction. Option D, carbamazepine ataxia. Answer is option B, ethosuximide hirsutism. Hirsutism is not a side effect of ethosuximide. Ethosuximide is a anticonvulsant drug that is used to treat petit-mat seizure. Common side effects are drowsiness, tiredness, headache, stomach cramps, and anorexia. The main side effect of benzotropin is option A, meiosis, option B, confusion, option C, diarrhea, option D, GIT hemorrhage. Answer is option B, confusion. Confusion is the main side effect of benzotropin. Meiosis, diarrhea, GIT hemorrhage are not the side effect of benzotropin. Instead of that, there will be severe mouth dryness, loss of appetite, severe constipation. These are the side effects of benzotropin. Which of the following statement is true regarding nitrous oxide? Option A, can be used with oxygen as a carrier gas for halothane. Option B, has poor analgesic properties. Option C, forms a vapor which is explosive. And option D, it is an effective agent for inducing anesthesia. Answer is option A. It can be used with oxygen as a carrier gas for halothane. Nitrous oxide is used with oxygen as a carrier gas for halothane. Which statement is true about codeine? Option A, is more potent than fentanyl. Option B, frequently cause diarrhea. Option C, used to treat nausea caused by morphine. Option D, depress the cough reflex. The answer is option D, depress the cough reflex. I hope you got some ideas about central nervous system pharmacology. These are some of the very important questions. It will be helpful for those who are preparing for upcoming examinations. In our next video, we will meet soon with the central nervous system disorders with the mnemonics and code for learning it. So, wait and see. Watch and subscribe our video. Thank you. Thanks for watching.